Good afternoon. I'd like to declare that I have no financial interest of a product in my talk or with any companies offering grant money for this continuing dental and medical education program. I only make money when you come to me. I'd like to have a show of hands of dental physicians that do cavitations at this time. Wonderful, wonderful. I'd like to have a show of hands of those dental physicians doing cavitations that also do blood draw in your clinic. Yeah, oh, fabulous. You're my kind of group here. I'm very pleased, I'm very honored from the IAOMT board to invite me to share our protocol that how we identify severe chronic infections and how we treat these infections. Where we are identifying, if you can think about disease or the etiology of disease as a river, we are all the way downstream at the mouth of the river, you have disease and you have pathology taking place. But if you go upstream, it's the metabolic problems upstream that are allowing those diseases and those pathologies to exist downstream. And what we're doing is we're really going upstream to identify those metabolic imbalances that are increasing the risk factors for disease downstream. So we're not looking into the signs and symptoms. We are not treating the symptoms. We are evaluating the inflammation and or where the toxicity site is. We know that inflammation is an acute phase reaction. However, hidden infections, which I'd like to present this afternoon, can be camouflaged. And these hidden infections then produce a toxicity upstream that is really affecting the liver. And with this liver toxicity, we're really running into metabolic imbalances. And a lot of our identification is taking place through OPG and ICAT scans. And every dentist, every patient that comes to me, I'm looking inside the mouth to evaluate the health of the gingiva. So my protocol is to come up with a treatment plan that is developed from an OPG and or an ICAT. We use acupuncture quite a bit. If you are able to get an acupuncturist close to you to do post-op acupuncture, I would be more than happy to send you my protocol. Everything that I present this afternoon, I'm going to make available to you. My blood test protocol, I will email that to you also. And if you have any questions in the future, I'd be more than happy to work with you. We do colonic hydrotherapy after our procedures, and we put everybody on their blood type nutritional food list. As a clinical nutritionist, I've seen great changes take place when you're starting to eat on your blood type food list. Our treatment teams. So you need a diagnostician doing laboratory testing. You need this individual then to also be doing the OPG, blood, urine, fecal testing. I am a firm believer in oral materials testing. I do a lot of hair elemental analysis to see the body burden of toxic heavy metals. We do quite a bit of testing of the amino acid. I've written several papers on this. The amino acid deficiency is incredibly, it's an epidemic, actually, and the hepatic function. Our oral physicians, I'm so pleased that two of my oral physician colleagues are here, Dr. Hank Marshman and Dr. Sadira Delisla is here. I'll be telling you a little bit more about the secrets of Dr. Marsman a little bit later. Acupuncturist, nutritionist, toxicologist, colon therapist, and a lymphatic masseuse to do lymphatic drainage after post-op can be very helpful also. So this is really the team that we're working with. We've been doing this for the last 20 years. And what we really have, I am outside of the governmental insurance program. So when you come to me, you have to pay out of pocket. And what we're really seeing, the kind of patients that we're seeing, are the patients who have been to several doctors. All of the doctors have told them that they can't find anything wrong with them, and finally they're told that it must be in your head. In fact, what they're missing is they're not realizing that the canary in the cage of your body is in your mouth. I know I'm preaching to the choir here, but most of you know this already. But it is really the oral cavity that reflects the health of the body. However, I want to stress, if you are missing teeth, that means that you're losing bone. And if you're losing bone, that means that you're losing muscle. And if you're losing muscle, then your amino acid pool is deficient. And if your amino acid pool is deficient, your liver does not have the basis, the foundation, to be able to keep you healthy. And what you're then getting is a lot of problems. It is you, the oral physicians, that are really in a position to be truly holistic. And it's my vision, it's my idea that in very short time, you trained dental physicians will actually be considered to be the primary physician for individuals. My colleague dentists are my primary physicians. If anything goes wrong, if I feel any symptom, if I feel any pathology, the first person I go to are my dental physicians, because I know that's where it's really starting. So, my personal diagnostic procedure, you do not come to me and tell me your problems and your complaints. I don't want to hear that. I'm doing a traditional Chinese medicine diagnosis. I'm looking and evaluating your age. I'm looking at your body mass index. I'm looking at your head here and your condition. I'm looking to see if you can rotate your neck completely from one side to the other. When you can't, I know that you have a pretty serious digestive dysfunction. I'm pressing my thumb over your tibia to see how much of a depression there is. For every millimeter that your tibia gets depressed, you are retaining 5% of your body weight in dirty water, in edematous water, which is a reflection of a protein deficiency in your blood. I'm doing an oral exam, and as I look at the tongue, I'm doing a cancer screen, of course, but I'm also looking at the tongue because the tongue has such tremendous amount of information. This is a pretty sad-looking tongue. The medial distal line in the middle of the tongue tells me that there is severe digestive problems. And you'll notice that the edge of the tongue, you see those little teeth marks there? Those teeth marks are what we call scallops, are indicating that there is a deficiency in energy. What's actually happening here is the digestive problems are not leading to a good digestive process that is not making available the amino acids and the fats to be converted in the mitochondria into adenine triphosphate. So we see these going together a lot. Under the tongue, we're looking at the condition of the liver, and we could see that this liver has what we call blood stasis. There's a lot of blood stagnated in the liver that needs to be brought out. Periodontal disease, we're looking at that because it's a tremendous indicator. I know that I have discussions with dentists about periodontal disease because I'm a little bit of a maverick. You're looking right now at the current etiology of periodontal disease that is really coming from exogenous sources or even worse, hygiene problems. And I've been looking at periodontal disease as subclinical infections that are actually coming from cavitations, jawbone infections. These infections then are exuding a very acidic pus that needs an egress portal that's coming out of the gingiva, and it's also spreading sideways. So I'm going to take you into the chicken and the egg conundrum. What happens first? Is it the dead tooth that produces a periodontal, apex infection, or is it the infection in the jaw that kills the tooth? All right, I think it can go really either ways. All right, when we talk about what you could do as an oral physician, I'd like to show you some advanced diagnostic procedures. I'm going to give you very basic values that you can use and what you can order, what they mean, and why they matter. A lot of dentists, what I hear at feedback, a lot of dentists or clinical nutritionists, both groups are really in the position to order script blood tests. The legality is, actually, can anybody tell me what the legality is of scripting a blood test? What? I'm sorry, not to diagnose. Well, you're right further on, but closer up, every laboratory wants you to tell them that you take responsibility for a low or high flag. All right, that's not diagnosing. All right, if you have an annulus that is on the low side or on the high side, the laboratory wants your assurance that you're going to figure out how to guide your client or your patient to correct this annulus. That's the only legality that's there. Yet, the interpretation that I'm going to present for you this afternoon is very, very straightforward. And when I send you the handout, when I email you the handout, you'll be able to follow this handout and know exactly what's going on. One of the biggest problems that I have with blood testing, and when I teach blood, my hematology protocol to MDs, the first thing I do is I ask them where their values come from, and very few of them know that laboratory values come from the data of people going to the hospital for elective surgery. Now, the first question we need to ask are, people going in for elective surgery, do they represent the healthiest part of our community? That's question number one. And question number two is what they're doing is they're taking 95% of the results, the second standard deviation, and they're considered that to be normal. And what happens is that there's such a variance that the values end up being extremely wide, all right, especially for thyroid figures. So what I've done is I've taken the first standard deviation, and I'll show you how that comes out. So there are several organs that we want to evaluate. If you are doing this protocol, you will know exactly what to expect from your dental patients. You will know which dental patients are at high risk for dry sockets. You're going to know exactly which patients are at high risk for losing their implants. And you will be able to really guide your post-op treatment by what you're seeing in these blood tests. So we're evaluating more than one area, and what we're doing first is we're starting off with the complete blood count. And there is a lot of material on the blood count, but there are only a couple of analytes that are really very interesting for you. We also want to include, I've never seen an MD order a CBC plus diff. All right? It seems that they have no idea what the white blood cells are doing. But the white blood cells are telling you quite a bit of information. So the first thing that we're looking at is in the CBC, we're looking at not only the immune status right now, but we're also looking at the inflammatory stress on this individual. If your white blood cell count is less than 5 milliliters per liter, this individual has an immune deficiency. And anything you do with them in your office, they're at high risk for a rebound. When white blood cells are more than 8, we know that there is an acute bacteria infection. When the mean corpuscle volume is less than 85, you're looking at an individual that could have G6PD deficiency. You have an individual that is B complex deficient, and you have an individual that is going to get fatigued very, very easily in your chair. When MCV is more than 85, this is a toxicity because the liver is not detoxifying the heavy metals. This is really an individual who is a great candidate for chelation. Taking your differential, your eosinophils, basophils, and monocytes, percentage, and adding them up, a healthy individual sum is going to be 8. When it is when it's equal to 7 or less than 7, you know that there is an inflammatory response. And the further to the left you go, the smaller the number is, the more chronic it is. On the other hand, if your sum is equal to 9 or greater than 9, then you know that there's a toxicity inflammatory response. And what you're looking at here is if it's 9 or 10, then you know that it's really an acute response. But if it's further greater than that, if you're looking at 12 or 13, then you know that this is really a historically long response that you have. If the mouth is the canary of your health status, then it must be that your thyroid is the canary of your immune system. And what we're looking for in thyroid values, we're looking for a thyroid stimulating hormone of less than 1.2, and we're looking for total T4 less than 8. You have this, and you have a hypothyroid patient who doesn't feel well, all right? She is gaining weight, she's fatigued, she's constipated, she's not sleeping well. The risk of depression is pretty high with her, and this is the underactive thyroid that is being attacked by the immune system. And when the immune system attacks the thyroid is unable to make a good amount of thyroxine, and you're getting all of the symptoms. All right? This is a high-risk patient for you. The other thing we're looking for is albumin. Albumin is produced in the liver. It is the #1 protein in your blood. It is responsible. It is your immune system gunslinger. It's incredibly important. And when we know that your albumin is less than 3.9, we know that the liver is not up to par, your liver is not stepping up to the plate, or there's any protein deficiency. And I'm going to show you that there are several protein deficiencies, starting off with digestive problems that are going, that are not being diagnosed. And of course, chronic hidden infections are just gobbling up the albumin. C-reactive protein, high sensitivity C-reactive protein is produced in the liver. It's produced in the liver because of inflammation. The high sensitivity reactive protein is considered to be a cardiovascular risk marker. If it's less than 1, your risk is considered to be very low risk. At one point, from 1 to 3, you have an average risk of having cardiovascular disease. And from 3.1 to 11, you have a high risk. I'm going to tell you right now that if your CRP has an average risk, there is hidden infections, unequivocally, because there's going to be there are going to be a lot of pathogens that are not even going to show up. And I'm going to give you some of those examples. So the liver is perhaps the most important. We know that the liver is producing albumin. We know that it is involved greatly in your immune protection, besides producing bile. It is responsible for your active phase reaction, and what it learns from its active phase reaction, it remembers in the adaptive phase reaction. We know that we've identified up to now 5 detoxification pathways of the liver. We have quite a bit of information on phase 1, which is your P450 pathway, that is converting your toxins into metabolites, that sometimes those metabolites are more toxic than the original toxin. And then we go to phase 2, where the material is going to be sequestered into cholesterol and bile to be excreted through your intestines, or it's going to be attached to sodium and phosphorus, which then your kidneys can excrete. We know that phase 3, there's no laboratory that can really test for phase 3 detoxification pathway. It is your ability to convert your ammonia into body urea nitrogen, and it is your ability, if you have the 5-methylfolate SNP, it converts your folic acid to folate and converts folate then into, breaks down homocysteine. It's homocysteine that most doctors are looking at as a cardiovascular risk factor. Unfortunately, they don't know how to help you convert your homocysteine back into cysteine. And you need your 5-methylfolate SNP, or you need to supplement with 5-methylfolate. Here is the biggest conundrum that I have with lab tests. Regular lab tests will have your liver values at 0 to 40. And the first thing that I do when I teach MDs, my protocol, I ask them, if you have a patient that comes in with their 3 liver values 0, 0, 0, you can't imagine that that liver is functioning. So the first standard deviation is then going to be between 15 and 30. Now, there are 3 liver values that are very important for you dentists. And the first one is GGT. And GGT is important to you because it is not only a liver enzyme, but it's also a bone enzyme. It's telling you what the bones are doing and therefore what is happening in the jaw. SAT is related to the liver, but it's also a kidney function. You're getting a real sense of what the kidneys are doing, and it is the LAT that is only liver specific. There's a little bit of LAT in the heart and the pancreas, but we really look at LAT from the perspective of what the liver is doing. Now, if your enzymes show up and you have a high GGT and you have a normal SAT and a normal LAT, you're losing bone. All right, and I'm going to show you how to evaluate how much bone is being lost. So anything that you're doing with this patient, whether it be an implant, all right, they're going to be at very, very high risk that this implant can somebody tell me what the rate of implant loss is in the United States these days? Maybe in Canada, not in the United States. It's closer to 14%. All right, that doesn't bode well. We'd like to reduce that. All right. With your liver values, you want to be looking for alkaline phosphatase, which is telling you once again exactly what the bones are doing. Alkaline phosphatase rises with infections, and it's made much worse by statin drugs, which are pure poison. All right, the idea that statin drugs, that it's cholesterol producing arteriosclerosis, is 40 years old. We're really moving beyond that, and I'm going to show you, how to evaluate that. So when you have high ALT and high AST with a normal GGT, you're losing muscle. One of the first things that I do is with my patients is with women, I want to know what is happening to the muscles in the lower arm, whether it's flabby or not. With men, you want to look at their calf muscles. Women lose the lower upper arm muscles, and men lose their calf muscles. All right? And so that becomes very, very important, because we know that when there is bone and muscle loss, if there's gingivitis present, and I will be able from a blood test to be able to tell the dentist what they're going to find in the gingiva. All right? And I'll show that to you. But once again, if there's any kind of irritation in the gingiva, there's irritation in the body. And we know that if there are lost teeth, there is bone loss. If there's receding gingiva, we know that there's muscle loss taking place. And the autoimmunity that I have seen in the last 30 years include Helicobacter pylori infections, the liver not producing a good bile, cholestasis, which your lab test can identify that. It's the cholestasis that then doesn't allow you to digest your food. Not digesting your food then produces digestive fermentation. Some docs call it the brewery syndrome. It is then that sets up a detoxification deficiency. Your mitochondria is not working well, and all of this is setting up where you're developing mandible infections, cavitations. Identifying how much bone is being lost is pretty simple. All right? We know that calcium exists in your serum, in your blood, in two states. One of them is, we call it bound, which means that it's attached to a phosphorus on one end and it's attached to a protein on the other end, and that calcium is getting ready to get into the bone. If you have enough vitamin K2, that calcium will be reabsorbed into bone. What is physiologically active in your body as the brake of activity is calcium, but calcium that's unbound, it's free. You want to have about 12% of your calcium in your blood be unbound. But if it's higher than that, then it starts producing a lot of problems. This is the foundation. So too high amount of ionized calcium indicates bone loss. The only thing you really need to be able to evaluate this is serum calcium and phosphorus. There is a formula that's a little bit more complicated that uses albumin, but I hardly use that formula at all. And what you do is, because calcium has 2 electrons in the outer shell, we know that it should attach to 2.5 phosphorus. So if you take your actual phosphorus and you multiply it by 2.5 and subtract it from your serum calcium, then you have your ionized calcium score. And what we know is that if your formula is less than 0.8, you know that your patient is building bone. This is a great candidate for any kind of dental work that you would like to do with them. All right, it'll be very, very stable. When your score is between 0.9 and 1.4, we know that the calcium is being deposited into joints. This is the arthritic patient that gets presented. When it's between 1.5 and 2.1, we know that the calcium is being deposited in the arteries, and this is the foundation. This is the real foundation of arterial sclerosis, not cholesterol. And we see, and in the future, you'll be hearing more and more about the cardiac calcium score, where they're actually being able to identify how much calcium is blocking the arteries of your heart. And by cleaning out the cavitations and putting them on supplements to get the calcium back into the bone, we see a reverse with the calcium score. If the results are more than 2.2, we see organ calcification. And as the calcification takes place in the organ, it doesn't allow the oxygenation to take place, and we're setting up a classic Werber effect where we're now at risk of cancer. So this is the more complicated one. If you'd like to use it, I'd be more than happy to send you the formula. I can also send you an Excel sheet that already has it in, so all you have to do is just plug in the numbers and it'll give you the results immediately. Okay, the other value that is very important is creatine phosphatase. We'd like to see it between 50 and 90. If it's less than 50, you know that the production of ATP in the cells are very, very deficient. If it's more than 100, you know that there's no question that there's significant hidden infections. And more than 100, you also have connective tissue breakdown, you have muscle damage. This is also happening, obviously, in the mouth. If you have a individual who has close to 800 under creatine phosphatase, CPK, you don't want them in your chair. They're really at high risk for a cardiovascular incident. We look at cholesterol, but we look at cholesterol not from the point of lowering cholesterol. All right, we know that when LDL is more than 60, it's more easily oxidized, and it's the oxidized. LDL is not bad. LDL is great cholesterol, but when it becomes more than 60, it gets oxidized, and it's the oxidized LDL that creates a problem. And what keeps LDL from being oxidized is HDL. But when you're not eating enough good fats, then your HDL drops, and if it drops below 50, we know that it's not protecting your LDL. So those, how far we have come from a fat-free diet being healthy to now promoting a healthy fat diet to keep you healthy. The whole idea of cholesterol is a sham. I'd be more than happy, if you're interested, to send you articles that state that if you are older than 65 and your cholesterol is high, it means that you're going to live longer. All right? So, all right? And when you stop and think about it, my brain is 80% cholesterol. Why would I want to lower my cholesterol? All right. Lactate hydrogenase is another one that's very important. More than 150, it's really a red flag that indicates that there's going to be a lot of problems. You have anaerobic metabolism. You have sepsis risk. Several years ago, a patient checked themselves out of intensive care. He had full-blown sepsis. Checked himself out, came down. I picked him up, and I took him over to Dr. Marsman's office at 6:30 in the morning, and we proceeded to pull 11 teeth out of this man's mouth and clean up his cavitations. He was on the job the next day, all right, having checked himself out. And that's how impressive some of these treatments can be. I told you that I could tell you what the dentist is going to find in the gingiva. The lungs balance your acidity by releasing carbon dioxide. Your ideal body pH is 7.4. So your body goes acidic to fight infection. And this is one of the complaints that I have with alkalinized water. Drinking alkalized water, all you're doing is just lowering your body's ability to fight infection. The formula is to take sodium and divide it by chloride, and the ideal is 1.4. That tells me that your body pH is 7.4. If it's 1.4 to 1.3, then we know that the patient's going to present in your operatory with tartar on their teeth. If it's 1.3 to 1.2, it's gingivitis. And if it's less than 1.3, they're acidotic, and they have periodontitis, and they're losing teeth, and they are really at high risk at this point. So let me summarize this part. Yeah? Laboratory testing is another tool that you can use in your practice. It is dentistry as practiced by IAOMT that's truly holistic. I would recommend going a little further to look at heavy metal toxicity. And we know that what I've shown you is that reduced hepatic function is really a reflection of health that you can see in the mouth. Okay. What we do is, for the last 20 years, we've been using OPGs and ICATs. And from them, we've been, this is a typical patient of ours with lots of symptoms and a lot of pathology. And I have to say that one of the bravest men that I know is sitting in front of you, Hank Marsman. Imagine a dentist doing his first cavitation procedure as I'm reading what to do from a Huggins book, all right? He was either incredibly stupid or the bravest man that I know, all right? And it was successful, all right? The woman was going to have a radical mastectomy because they had seen a shadow in her breast, and she had a lot of breast pain. And when we removed the cavitation, she went to the hospital 4 days later for the operation, asked the doctor to show her, the shadow, and he couldn't find it anymore. And because her pain was gone, she left the hospital. And that was the beginning of a journey that I've had with Dr. Marsman that has been an incredible journey, and the patients of ours that have been able to benefit from it are just absolutely extraordinary. And we're now also very proud that Dr. Sadira is joining and becoming a believer. We have the lower right is a cross-section of a healthy mandible, posterior part of the mandible. In the upper left, you could see that's a very typical cavitation. This really comes from the Dietrich book, the presentation that he gave in Dallas in 1972, long time ago. Interestingly, the young man whose cavitation was done during his autopsy was a 27-year-old boy who committed suicide because nobody could fix his headaches. They were so severe. So the treatment steps that we're doing is that we're looking for dental material testing. We'd like to do hair analysis to see what the toxic burden is. We want to start with a periodontal cleaning with herbal solution. That herbal solution is incredibly important to helping control the biofilm in the mouth. We wanted to remove all of the amalgams. We want to remove the amalgams that we usually find under the crowns. We want to then extract the root canals and devitalize teeth, and then we want to treat the cavitations. And what we have is under a local anesthesia, the gingiva is incised. The outer mandibular periosteum must be drilled to expose this mushy, semi-liquid mass on the inside. The material is cleaned out. The sides of the cavitation are deburred to introduce a healthy blood flow, and then it's ozonated to really extract and to sterilize as much as possible. We will then realize that this abscess, many times you don't see it on the OPG because it's not been calcified. The calcification has been melted away because the pathogens has such a low pH. All right? So I can't stress enough the positive clinical results that we've seen with these procedures, and we are really doing an upstream remediation that really helps it downstream. Tomorrow, I hope we have the honor to be able to hear the lecture of Dr. Lechner of Germany. Dr. Lechner has identified all of the pathogens that are found in the cavitations, and they have then verified what we've seen on a practical basis, that cancer, arthritis, prediabetes, any autoimmune disease, we have seen a improvement after doing cavitations. The remediation team, I'm so pleased that two of them could join us today. We know that the ozone is fantastic. There are lots of people below with the ozone that if you are not doing it now, I certainly recommend that you get into it. The other thing that we're doing is the leukocyte-platelet-rich plasma. I can tell you from experience that the healing after doing a cavitation and being able to put in the LPRF is absolutely incredible. I'm talking, of course, out of experience. Here I am having my blood drawn for a procedure that I had 2 weeks ago, removing my cavitation. Dr. Marsman doesn't like working on me because I'm a really bad patient, but We did it anyway, all right? I can tell you that the treatment results and why we're doing this is really to improve the health of our patients. And I can tell you that the effects have been so positive over these years. I want to just mention, we're running a little tight. I just want to mention Helicobacter. Helicobacter ends up being really an insidious disease. The reason that I really want to mention it is because this year alone, we've had 7 patients who had the 2 antibiotics for Helicobacter, and after the treatment, they were still positive. When I look into the literature, the doctors are now talking about Helicobacter-resistant antibiotics. And I don't believe that this is true. First of all, we don't know the source of Helicobacter. Most doctors won't even test for it. It's like the yeast. You know, doctors don't believe in yeast. Everybody has yeast, so we can't test for it. You can test for Helicobacter. The only way I believe in really testing for Helicobacter is through a fecal sample. I don't believe in the gas. I don't think it's reliable. The only thing that I don't like so far is we haven't been able to come with a fecal amount of Helicobacter. So we don't know if it's a high infection or a low infection. Interestingly, Dr. Lechner, I sent a German patient who could travel to Germany who was still positive for Helicobacter. I sent him to Dr. Lechner. Dr. Lechner contacted me telling me that they had found Helicobacter in one of his cavitations and told us which cavitation to clean out. This is phenomenal. We cleaned out the cavitation. We put him back on the 2 antibiotics, and 16 days later, he was HP free. All right, so this is really an indication here. So cleaning out cavitations, we're really seeing that you're stimulating the healing process, you're reducing insulin resistance, you're reducing the muscle loss, you can completely eradicate arthritis and arteriosclerosis. We've never had a cancer patient that did not have cavitations or root canals, which is the same thing. We've seen great improvement in chronic sinusitis, and we've been able to handle every case of sepsis that we've had. All right. You can, because you can have supplements in your office, there is a supplement called active Hecos correlated compound that increases your immune system by 300%. I've been using it for several years. I have a couple of research projects using it. We just got back from Japan where I presented on our results using this product. It's an oral supplement. It is something that it's really worth looking into. I get no money from this at all. I do recommend that you do oral materials compatibility testing, that you do pre and post blood test. It's a great way to show the patient how much they have improved. I'd be more than happy to send you my acupuncture protocol to reduce the pain. Our patients don't take anything for pain after extractions or after cavitations. So, thank you for bearing with me. I hope that I have shown you that many infections are rooted in fatty degenerative jawbone infections that then are presenting in many dental problems. However, if you identify and correct this fatty degenerative jawbone infections, you are really truly supporting the body's innate response, and from it, you're really improving their health status. No questions. They'd like us to go afterwards where everybody will be able to have. I'm excited that there is a question, though. All right, I want to thank everybody.